All right, can everybody hear me? Probably very well. Hi everybody, I'm Connor Hanley. I'm the Community Sales Director here at Brightview Senior Living in Towson. Thank you all for being here this afternoon. Thank you to Deb Biglich for co-sponsoring and hosting, and of course our very special guest, Dr. David Ajibade. I'll let Deb introduce him, but I just wanted to welcome everyone. If you're interested in seeing the community after the presentation, we're more than happy to give you a tour.
Thank you, Connor. Well, first of all, thank everybody for coming. This is a great turnout for Thursday. My name is Deborah Baklich. My information is also on the table. And I am the owner of Senior Care Lifestyles, and I navigate families through all care options. Brightview has been a partner with my company for over a decade. And we work together on bringing clients here that need assisted living, memory care, and some of their communities are independent. So we're a one-stop resource for people who are seeking just navigation and guidance as to what's the next step for a senior loved one. So if you're dealing with anybody who you're concerned about, we're a single resource, Deb is, Connor is, and we'll all be here after the presentation if you have any questions. And they will be doing tours of Brightview as well, if anybody is interested in doing that at the end. Now, I am very honored to introduce Dr. David Ajibade. I met him, and Brightview and I were at an event, and we heard him speak, and we looked at each other and said, we need to get his message out there. So we are partnering with Brightview and going through the various Brightview communities to bring Dr. David. And his bio is on there, and that is just an overview. It's a very highlighted overview, but he had a 5-page resume, and I said, we can't put this on the table. So I'm gonna turn it over to him and let him do Keeping Your Marbles. Thank you.
Thank you. Okay, that's a little loud. Good afternoon, everyone. Thank you, Deborah, for making this happen. And thank you, Deb, Hanley, and Connor for making this happen and being open to taking the risk with me. So I'm going to say a few things about what I do, but we have a lot of slides to go through, lots of pictures, but this is a relatively small group. So if there are any questions that I can answer quickly, I will. If not, we'll just move on. Is that okay? How is my voice coming across so far?
Very well.
Is the accent in the way? Okay, all right, cool, good. If it does get in the way, if things change, just let me know, okay? There's no problem repeating what I said. All right, so a few things about myself. You already have that in front of you. I live in two worlds. I live basically mentally and physically, I live here, but I also work in Nigeria, Africa, where we deal with brain disorders of every kind, from kids with severe brain damage all the way to strokes and dementia. My passion has always been to try and find the safest, most effective way and quickest, really, to addressing brain problems. One of my frustrations in medical school was that we would describe, in our neurology classes, we would describe brain disorders, and we would have pages and pages and pages, full description. But when it came to treatment, or how to reverse or how to cure it, it would just be about 2 lines, and basically it mounted up to supportive care. We'll just try and manage the individual until things change or a miracle happens, or the end stage. So that was always a frustration for me. So over the years, I've learned how to, thankfully, because I kept on coming back and forth. I would travel back to the US, I would go back and forth and learn these things. So a lot of these things I'm learning, I'm going to share with you, are research-based, but there are also things that we've tried out in the field where there's absolutely nothing. We don't have MRI scans, we don't have CT scans, we don't have all the great technology you're all exposed to here. We deal with things that are the most basic, so we know what works. If it doesn't work, it doesn't work, and we try something else. And it had to be safe, obviously, because we're dealing primarily with kids and later adults. So again, if I say anything that is, out of the way or something that you haven't heard from the professor in Johns Hopkins, it's just seen as something that is different, not necessarily wrong, okay? And I know some people react to it sometimes and they're like, oh, well, it's not from Johns Hopkins. Johns Hopkins is a great university, but the truth can be found elsewhere as well, okay? How are we doing so far? We're good? Okay. So I'm very curious to know how people are dealing with, or how people perceive the topic of dementia or cognitive decline. Is anybody are there any fears, any frustrations? Is anyone dealing? I'm assuming there will be somebody dealing with someone who has dementia. Anybody bold enough to share briefly about your experience? Anyone? Yes, ma'am.
My sister has Parkinson's, and with that has that dementia component.
Okay. Is it Lewy body or just Parkinson's?
Yeah, I think it's just a Parkinson's dementia.
Got it. What are you? Yes, ma'am.
My husband had PSP, which is a form of Parkinson's, which affects the brain with the tau plaques, and he passed away from it.
I see. I'm sorry to hear that. Yeah. Yes, sir.
We have a couple friends where their father or mother has got dementia, but trying to identify that fine line where you can't take care of them anymore and you have to take them to some other place for better care.
Yeah. And it can be quite expensive too. Other than the fact that he may not want to go elsewhere. That's another big challenge too. Yeah. Yeah. So there are lots of frustrations and fears that people are dealing with, and I hope we can cover some of them as we go along. So my mission today is really to let you know that there is hope. There's a lot, quite frankly, that can be done for even the worst cases of dementia. There's a lot, but it will come really from you all learning about it yourselves. Because from my experience, I spoke throughout the city of Baltimore. I did a lot of work with the Department of Aging, and I would speak in all the different ranges of communities, predominantly black, predominantly white, Jewish neighborhoods, Jewish senior centers, and it all came down to one thing. What we found out is that people simply didn't know the things that were affecting their brains for better or for worse. And because they didn't know, they were constantly doing the things that were harming their brains, or not doing enough to protect their brains. So that's why it has become a big mission of mine, really, to see what we can do to address that lack of education. So with that, let's start. And I'd like to start with shock and awe. This is what we're fighting against, right? This is what we don't want to happen. The brain, by the time a person has full-blown dementia, the person's brain has shrunk by about 30% or probably more. That is a lot of brain tissue. When you consider what the brain does, it drives everything in the body. People say it's the most complex piece of biomechanical electrical machinery in the known universe. It does a lot. So once you lose that much tissue, that explains a lot of things that go on in your body, doesn't it? So I'd like to start. I'd like to just give a summary, go right to the end and just tell you what it is, just in case somebody has to leave for whatever reason. So we start with the end, and then we kind of like work through the details. What they say, tell them what you're going to say it, and then tell them what you said, right? So keeping your marbles, right? Keeping your marbles has to do with three things. We try to put it in a framework. There are three things that you've got to be pretty clear about. The brain, when a person succumbs to dementia, it's because over a period of time, there have been greater attacks. That could be the duration, it could be the frequency, it could be the severity. Number two, it could be that the person's defenses are weaker than the average person's defenses. And that again could happen as a result of several different things, which we'll discuss. And then number three is that when things began to go wrong, that individual did not get prompt treatment from the medical profession. All right? So the key to keeping your marbles is really to reduce or or neutralize them, but you got to know where those attacks are coming from, because if you don't know where they're coming from, you will not know how to reduce or avoid them. Number two, you've got to strengthen your defenses. What are the defenses that your body has put in place, what that your brain has put in place to prevent things like dementia? And number three, you've got to know your numbers. There are certain tests. They're not all these elaborate tests. I mean, elaborate tests are good, but you and I know that most people don't have access to those high-tech research tests. There are simple tests that you can do to assess the quality of your brain health. Very, very simple. All you need to do is ask your doctor, because he's not going to tell you. He's not going to volunteer that information, unfortunately. All right, so back to this picture. There's a lot of information. I'm just going to rush through it. Why this is very concerning in the US, and a lot of you probably know about this already, but it's dementia is the number one cause of death in the UK. It's the number two cause of death in Australia. Number one among women, and in the US is rapidly rising through the ranks. So there's a lot that we're concerned about. And again, there's the racial component as well. They compare it to they compare it to cancer. It's worse than breast cancer. We do a lot of shouting about breast cancer, but a woman with dementia is more likely to. Okay, no problem. When it comes to cancer, dementia actually trumps cancer. So let's talk about a few myths and truths. Some of you may have heard some of these, so I'm just going to quickly go through them. Again, I just want to say, I may say some things that are contrary to what your doctor has told you. Don't get upset. Just write it down and go back and do the research for yourself. Okay? Nobody knows everything. And I have tremendous respect for the medical profession. I became a doctor in 1997, so it's almost 30 years now that I've been a doctor. So this is my whole life, so I do have a lot of respect. But there are some things that I had to learn outside of medicine to be able to do what I'm doing today. And I still treat, by the way, patients virtually. I'm licensed mainly in Nigeria, but I have virtual patients around the world. So there's about 5 or 6, I'm just going to rush through them because we have a lot to talk about. It is still said that Alzheimer's disease cannot be prevented. We're trying to find a cure. We have not found one yet. But the truth is that we are now finding out that there are a lot of different things that people can do to prevent dementia. And the Lancet is one of the top journals in the UK. And they have about 12 different things that you can do to reduce your risk of dementia. My problem with this list, if you take a look at it, is that a lot of it is just so vague. It's like physical activity, eat well, have good social relations. Haven't we all heard this before? These are the same things they will tell you about when you're trying to reduce your risk of heart attacks, exactly, or something else. So I think, in my opinion, we need to have something that is specific, context specific for women, context specific for men, context specific for black people. We have twice the risk of dementia as white people, and that is what helps people more, in my opinion. And there's another great study, speaking about prevention, there's another great study by the Dementia Alzheimer's Association, whom I worked with for a while, and they said one single nutrient, just one single nutrient, if you had ample levels of that nutrient in your blood, you had a 40% reduced risk of dementia. Just one nutrient. Just one single nutrient, folks. What is that nutrient?
Exercise.
I'm not going to tell you now. I'll tell you later. we like to keep the suspense a little bit. All right, number 2, I will tell you, I promise. It's always, Alzheimer's disease is not always about memory loss. You could have almost perfect memory and still have dementia. I know you probably didn't know that, because it affects, Alzheimer's disease affects different people in different ways. It could affect your mood, it could affect your regulation, it could affect your cognition, your ability to think, to do calculations. Let's go to number 3. It is caused by amyloid plaques. Now this is where I really get in trouble. Really get in trouble. And just hang tight, folks. Just hang tight, all right? I'm going to walk you through it. Okay, it's, yes, amyloid plaques play a role. But I tell you, from the research they've done now, they've done several to say it's 50-50. And I'll explain what that in a minute. So those reddish things are the plaques, and the actual things over here are the neurons. And we'll talk into that more, speak to that later on. What we're finding out is that it is more an effect in addition to a cause. All right? It's something that we're beginning to see that happens as a result of things that have already happened to the brain over a period of time. All right, let's go on. Myth number 4, once you have the genes for it, you will have it. The truth is that it's less than 3%. If you have the genes, ApoE4, everybody familiar with that? The ApoE4 genes is a very popular gene connected with Alzheimer's disease. Yes, it does increase your risk of dementia. However, lifestyle factors, diet, environment, all play a role. Bottom line, knowledge, knowing what to do and how to do it can give you a much better leg up than even someone who does not have the genes and doesn't know, okay? Once damaged or lost, brain cells cannot be repaired or replaced. Have you all heard that before?
Yes.
Okay. You do know that the brain makes new brain cells every single day, right? New brain cells, whole bunch of them. That's standard, even into your old age. There are things that you can do to influence the rate at which your brain makes brain cells. Absolute fact right there too. So we're going to, I don't know how much time we're going to get. We have to do that, but let's start with the basics. You know, remember that song? Let's start at the very beginning. A very good place to start. When you read, you begin with ABC. When you sing, you begin with what? Oh, I love you guys already. Okay, when it comes to dementia, it starts with what we call the synapses. But let's talk about the definition first. Essentially, the dogma or the commonly held belief is that Alzheimer's disease is caused by it's a neurodegenerative condition with memory loss and a few other things that are caused by the appearance and proliferation of these proteins called amyloid plaques. And when these proteins, they spread over the brain and eventually they strangle the nerves and the connections and shut things down, and eventually the person dies from actually, for the most part, they don't die from the amyloid, the dementia. They die from other things like pneumonia. But bottom line is that these plaques cause damage. So this is what is being held, and this is what billions and billions of dollars are being spent on to actually address that problem. Okay, so I just have this picture here just to show that there are about 100 different kinds of dementia. Alzheimer's disease is only one. However, it's about 75% of all dementia, so it's a big deal. So I'm going to just start with, speaking about starting at the very basics, let's talk about that, because if you don't know how your brain works and what is most important to your brain, how on earth are you going to know how to protect it? You got to know what are the most important aspects, and then you can now build upon it. So at every point, whether your sleeping moments, your waking moments, whether you're at work, you will know how this is affecting your brain. And then it'll be up to you, really, whether or not you want to do the right thing to protect your brain. But we've got to get that information over to you as well. So this is, over on your right side, you've got 2 brain cells. Those are basically 2 brain cells coming together to form a synapse. Before anything happens in the brain, there has to be a connection, there has to be the transfer of those little bubbles you see. Those are chemicals that go from one brain cell to the next. That connection, that transfer of chemicals has to happen. And it happens trillions and trillions and trillions of times all over the brain. I mean, your brain is a cauldron. It's like a volcano of activity. You're listening to me now, you're thinking about, you're hearing words, you're putting them together to make sense to you. English may not be your primary language, it may be a secondary language, so you have to translate to your secondary, your primary language. You may be thinking about food, your brain is worried about someone who said something mean to you a few days ago. All these things are going on, but your brain is handling everything, hopefully well, okay? At the same time, it's handling all your digestion and your drinking and everything. This has to happen. I want to really emphasize this. This has to happen. When this does not happen, things go wrong. And so I look at it as like the basic family unit of the nation. So you have the family unit, the family, the clan, the village, the city. This is the basic, the parents and the child, okay? Let's move on. So that connection forms trillions of networks. We know there are about 100 trillion connections between brain cells all over the brain. One single brain cell could have as many as 10,000 connections, as many as 40,000 connections. That's a huge amount of complexity, all right? Now, I have this picture here because connections matter in the outside world. Ladies understand this intuitively better than men do for some reason. Ladies, social network is stronger among ladies. What we know, and research study after research study, the most prominent one is the Harvard study, which followed people over 80 years, and they found out that those who were the happiest, not just the happiest, but the most successful and the healthiest were those who had healthy relationships, multiple relationships, okay? So as it is without, so it is within. The brains that do the best, right, are the ones that have the greatest numbers of connections. And they're not just the static connections, but they're the ones that are able to quickly form connections. And once those connections are not working like they should, they're quick to detach and attach to another connection. That's what makes for a buoyant, vibrant, healthy brain. And no one depicts this more than our man himself, Einstein. That's a funny fun fact. When they dissected his brain after his death, they found out that he had significantly greater connections between brain cells and regions of the brain than the average person did. Food for thought. So that's the problem. You have all these connections. So having many connections makes for a healthy brain. But the problem is that, let me see if I got this right. The problem is that you need a lot. Everybody say with me, a lot.
A lot.
A lot.
A lot.
Is somebody making fun of my accent there? I'm just kidding. You need a lot of energy to maintain the synapses. That makes sense, right? Okay, so let's talk about that. I used to joke about this number. I used to say, I've been teaching about this for a long time. So I used to say that this is not when the world is going to end. But that date is past now, so I can't use that joke anymore. So I got to come up with something else. But this is why this matters. Your brain is 2% of your body weight. But it requires over 20% at rest of the energy that your whole body uses. 20% of the oxygen, 20% of the carbs, 20% of the nutrients. It is an energy hog. Okay? Are you beginning to see where the problem lies? Okay, let me make that clearer to you. 60 to 80% of the energy that the brain uses goes to the synapses, the network. So let's connect the dots. If your brain is not getting enough energy, it is not going to be able to maintain the networks in the brain. And remember what we said. If the networks aren't working, if your brain cells aren't able to quickly connect with each other, all kinds of things can go wrong. Everything from not being able to, simple things like not being able to follow a conversation, not forgetting where your keys are sometimes, but worse, when they hand you your keys, not knowing what those are for, right? It affects sleep, it affects so many different things. So, You've probably heard that term. It's a very technical term, by the way, brain fart. So let's talk about a few instances, and maybe you might be able to relate to some of these things. I mean, when I say relate, you being relating to some of these things, I don't mean you specifically. I'm talking about maybe you might have seen or heard somebody behave in that strange way. So I'm not going to go through everything. This is actually from Alzheimer's Association. They've got some really good content, by the way. So misplacing things, problems following a conversation, trouble understanding images. That's why sometimes the kids take the keys from their dad because he's not following the signs. Green light to him might mean red light and means go. You know, that can cause a lot of trouble, right? So all kinds of things can go wrong. So it's about the synapses and it's about energy. Those are the two main things I really want you to take away from here. It's about how well these connections are happening in your brain. But here's the problem. As we grow older, with every passing decade, there's a reduction in energy levels available to the brain. Okay? Now with women, it's even particularly a problem because when you hit menopause, now this doesn't happen to everybody the same way, but some people, they have a really bad drop in certain hormones. What you probably don't know is that estrogen is probably the most important hormone for the brain, and it's extremely important for brain energy production. So once you hit that point and things go down in energy in terms of estrogen, and it's not just estrogen, by the way, there are other things like progesterone, but estrogen is the key thing. You, again, it happens in different ways to different people. Some people don't feel anything, but others do a lot. So that drop has a huge implication, which is why women tend to have it twice as bad as men do. One of the reasons. Now I give a whole class where we look through 12 reasons why women have it worse than men. So it's not just menopause. There are other things as well that we can't talk about right now. All right. So, and it also happens to be that the parts, I mean, it makes sense, right? The parts of the brain that are most affected by this drop in energy are those parts that use the most energy. And those are the parts that have, for example, things to do with complex thinking and reasoning, things to do with listening to words and applying the words or speaking words. So things like digestion, they get affected much later down the line. But the things that make us human are the things that are first to go. All right, so when I learned this, I had been, like I said, I had been treating kids and adults with brain disorders. I just assumed everybody, we just had to fix the brain problem. So before I learned about this, I would just jump, if someone came to me with a stroke or dementia, I would just jump right in and say, let's fix the brain cells, let's try and get the brain to make new brain cells, let's reduce inflammation, and so on. Then, when I learned about this, I realized the first thing you gotta do is find a way to restore or turn up the volume of energy in the brain. Does that kind of make sense? Okay, because if you're not doing that, most things aren't going to work as well. And like I said, with kids, I never thought about it because, as you know, kids, if there's one thing kids have, right, it's energy. Besides that, they haven't gone through all the failures and the problems in life, the grief, the loss, the injuries in the past. I mean, they're just bright-eyed. They're looking forward to the future when they can ride their own bicycle without extra training wheels. They're just all forward thinking. And those are huge things to help a brain work better. I mean, they have no biases. They just love everybody, right? So that's a huge, to me, it was a huge shift. But once I started to learn how to do that, I began to, got to results. I mean, for instance, I had this elderly man in his 70s. He had severe dementia, living in the UK. So I was working with his wife. And among the things that she complained about was that he would watch TV and maybe watching a drama class or something, a TV show, and then he would get upset with the people on the TV and start shouting back at them and really engaging in some kind of dialogue, right? Another thing she mentioned was that, so they would have this nurse come in to help out, a white nurse, there from my tribe, so they were speaking Yoruba, and he would speak Yoruba to the white nurse and speak English to his wife. So it was just kind of like mixing things up. Again, back to the synapses, the connections are off. Sometimes it just happens, just like a glitch, it happens once or twice, and then the person moves on. Other times it's more, especially as the condition progresses, it becomes more intractable. Another example would be like you're walking past, you're in your 80s, you walk past the mirror and you look in the mirror and you see, oof, who's that old person in the mirror? That's not me. And as far as I'm concerned, I'm 25 years old, and that's haggardly, scraggly looking person is not me. So, does anybody have any stories like that? Anything that you can relate to that? See, I'm curious. Anybody? Anyone?
I say it, but I know it's me.
You know it's you?
I know it's me, but I say it anyway. Who's that old person?
Don't we all say that to ourselves in the mirror? Thank you. Anybody else? Okay. All right, let's move on. Okay, so this is I like this definition from the Alzheimer's Association because it's an upgrade and it better reflects what we're talking about. And the key thing here I've highlighted is a disease caused by complex brain changes following cell damage. Now, the only problem I have is with the word damage because it doesn't have to be damage. It could just be, like we said earlier, the brain simply isn't getting enough energy. And like I said earlier, it happens decades before the first symptoms of dementia occur. Your brain is really resilient. I mean, it takes a lot for it to buckle. And quite frankly, a lot is happening to our brains these days. COVID-19 is one of them. There's a huge aftermath that's going on with COVID-19, and we're seeing an uptick in dementia cases since the pandemic. Okay? All right, we said this. My career started, I started as a cancer, in the field of oncology. So I'm beginning to see this, I'm seeing some parallels between this and cancer. When it comes to dementia, it's like the brain is shutting down. Did I say dementia or cancer? When it comes to dementia, it's like the brain there's a program that's going on. And they've studied this and they've proven this in the lab. And they've proven this in clinical studies. There's a program in the brain that is responsible for the brain actually retracting and cutting back on the synapses themselves because the energy levels are not adequate to meet the network, the requirements of the network. So the brain is actually part of the problem. I know that sounds really hard to take, but part of the problem is that the brain is shutting down. And I bring up cancer because in cancer is the complete opposite. The brain is expanding. It's expanding. The disease, the cancer is expanding until it becomes too suffocating for the brain. But in dementia, and that's why the brain is shrinking. It is actually a program that is going on in the brain. So at this point, what would be the $1 million question? What's a good question to ask?
How do we increase the energy?
Oh I love you. Great question. Absolutely. What's your name, ma'am?
Dee Dee.
Dee Dee. Great. Are you a doctor?
No.
No? That's a great question, Dee Dee. How do you increase the brain's energy? Okay. I can tell you this. It's not by giving it Gatorade, a Monster, or Red Bull, whatever kids take these days. And the reason for that is because that's the fuel. That is just the fuel. The machinery, the brain has to use the fuel to make energy. And so that's the problem. Got it right there, did he? That is the problem. And again, this is probably not a good time for it, but I will. The next one. The next question is what is draining our brains of energy, and that's where we come to this next topic. I called it the dementia's dirty dozen, because there are about 12 things, 12 different categories of things that we have seen over the years that drain the brain's energy, that causes damage and dysfunction. Some of them are obvious, others not so much. We don't have too much time, so I'm going to just pick on a couple. But what stands out to you? Is anyone you want me to just highlight real quick?
Isolation.
Isolation, yes. Good point. Inactivity. Yep. Insomnia. Lots of research coming on about insomnia. Yeah, and that's one of the 12 reasons with ladies too. You all have greater. I'm saying the obvious. You know that, right? You have greater problems with insomnia than men do. Lots of research showing exactly how insomnia, showing you the path to dementia from insomnia. Same thing with isolation. Who would have believed that? There's a huge amount of energy boosting that comes through connection. The chemicals that are produced from good quality connections have huge benefit for the brain, especially when you're going through treatment for dementia. Anyway, more about that some other time, I guess. But so when we created this checklist, we just started looking at different things, and that's how I came up with why would women have it worse, why blacks, for instance, have it worse, why firefighters, why. So 9/11, you all know that 20 years ago now, that's many of the first responders are coming down with major problems like dementia and cancer. COVID-19, I mentioned COVID-19. Interesting thing with COVID-19, those who had loss of smell, some kind of loss of smell, had an even higher risk of dementia than even those who had severe lung problems and were admitted. If you added the component of smelling loss to the COVID-19, you had a higher risk. As a matter of fact, they're now finding ways to treat people with dementia by improving their sensitivity to smell. All right. So when we were in medical school, they would say common things appear commonly. So don't think brain cancer when you have a headache or when you see a headache. Think about the most common things. So I just want to highlight a few things here. Number 6 there, medications. We know in senior living, you guys use a lot of different kinds of medications. Different doctors see you, and sometimes they do not talk to each other, and so they kind of recommend different drugs. That could be a problem when it comes to brain energy. All right, there are so many different factors. There are also ladies, well, not just ladies, cardiovascular disease is a big problem too. People with atrial fibrillation or some problems with the heart, or just things like high blood pressure or even diabetes. Anything that compromises blood flow to the brain and within the brain can have a significant effect and lead you on the path to dementia. So it's extremely important, one, to get good medical treatment, but more importantly, know what to do. Everybody say do. Do. It's not just about knowing. You gotta do certain things on a regular basis to support, strengthen, improve your brain's health. Okay, so let's talk about seniors. Isn't it fun to know that your brain is getting older and older as you get along? No? What? Okay, age is obviously the greatest risk factor, and we have this little timeline here. So from 0 years conception when you're born all the way to 100 years. Full brain development happens when you're 25. So after that, it's all downhill from there.
Been on the hill for a while.
You've been on the hill for a while, good for you. I'm just kidding, guys. Forgive me, all right? I'm just trying to. All right, so just a few things here. I've mentioned menopause. 65 is usually when we begin to see things begin to falter, and by 80, about 50%. Is there anything else I wanted to point out here? All right, so let's talk about certain cases related to seniors. We've talked about over-the-counter medications. You've got to be your own, you or your spouse has to be, or have to be your own advocate for your health. You just can't accept everything. You got to know, when they say your test results, and I'm going to talk about certain tests you need to do, you got to know what the numbers are. Don't just accept, oh, it's good, oh, it's in normal range. You got to say, doctor, please, what do my tests say? And ask for certain tests. Number 3, mobility, balance. Okay, I mentioned smell. Hearing too is a big thing. Loss of hearing also predicts dementia, especially over a period of time. So please get your hearing aids. Get your hearing aids. Don't try to rough it out. Don't soldier on. Get your hearing aids. Believe it or not, antacids, because they block certain nutrients your brain needs, amongst other things, from getting to where it needs to. I have a patient who for 40 years used proton pump inhibitors, which blocked acid production. 40 years. Now they're saying you shouldn't use it for more than 6 months. He used it for 40 years. Came down with dementia. What was that?
I said I have clients where I get their medication lists, and just about everyone is on pantoprazole, omeprazole, something for acid reflux. It's about everyone. It's a lot.
Oof.
Yeah.
Well, here's a good thing. There are options now. There are alternatives that are safer, probably more effective to help to repair damaged linings. All right, so let's talk a little bit about this, because I think this is very important. Ladies, you gotta be active, but probably more important than that, you gotta, not just the arm muscles, the leg muscles, more importantly, because of balance. Once you have a hip fracture, and this happens more in ladies, there's a 25% chance that person dies within the first year. They may not even leave the hospital if the person has a hip fracture, and there are several reasons for that. Gabrielle Lyon is a doctor who is really going out and shouting about the importance of having good muscle mass, good muscle strength, as a direct supporter of the brain. The more muscle mass you have in your older years, your latter life, the more your brain is protected and strengthened. It's good to walk regularly, that's good. You now need to take it a step further and start to strengthen your legs. And Brightview is a great place where you guys have all the trainers, right? You have trainers, and I saw that I walked past the gym.
PT,
pretty nice.
There.
What?
They have PT, they have OT, they
PT,
have
OT.
a gym, they have everything. They do SPICE, which is an exercise program. They do a lot.
Great. So you got to ask. You got to ask whomever you're working with. Ask them to safely show you how to strengthen your limbs, your legs especially. So I did this talk in Tulsa, Oklahoma, and Janelle and her daughter walked up to me, and I was talking about muscle mass. And Janelle is in her 80s, and she walks up, she does this. She says, feel that. And I did. And folks, honestly, I don't know what else we talked about after that. All I know is I just kept on saying, yes, ma'am, and no, ma'am. Anything else, I didn't want to get in trouble with her after feeding those muscles, those guns. So these three, I kind of alluded this to you already, that there are 3 groups that have twice the risk of dementia as the rest of the population. Military veterans, women, and blacks, okay? And there are reasons for that. And I'm shocked healthcare experts are not telling us why. And they just say a few things where basically we're still doing research on it. I'm telling you, there's a lot already we know that affects this. Anyway, I'm very concerned about this, especially since I fit in 2 of these categories. And just so you know, it's the military veterans. I just really think that to be clear about it. So this is what we started with, the 3 pillars of dementia. Another way to think about it is, look at what are the things that weaken your brain and avoid them. What are the things that strengthen your brain and embrace them? I mean, you're not going to get everything right at once, but you need to start on that path. And number 3, know what tests to do and make sure that those numbers. You see, you're in a great country, in a great state, great city. I understand Maryland is one of the most highly educated, it is the #1 highest educated state in the country. Did you know that?
No.
More than Massachusetts.
No.
I mean, I could be wrong, but I checked it. I mean, you could check it again. But, I mean, don't take me to court on this, okay? But this is we're highly educated.
In Maryland, yeah, we're smart.
Maryland, yeah.
Because of all of our colleges.
All the colleges and of course all the research centers. All the research centers, government research centers as well. So I'm just going to highlight a few things because my time is fast spent.
Okay, you're fine, you're fine.
You sure?
We ran a little late, we started late, so you have about another maybe 10 minutes.
10 minutes.
Everybody's okay with that? Okay, keep going. I think you want to.
This is the best part, you want to tell them.
Okay, all right. You heard the lady. Did you bring your blankets? Your pillows, maybe? I'm just kidding. All right, hang on, let's get some more. So what I'm... Oh. Let's happen. Please. Okay.
There you go.
All right. So I thought we should practicalize these things. So the first thing, what are the things that hurt us the most? The most common thing, obviously, is sugar. The average American takes a bunch of sugar. We don't even realize where the sugar is. I mean, it doesn't have to be sweet to be sugar, right? Your body breaks down starch. Crackers may not taste very sweet, but I guarantee you, your body breaks it down into sugar. There are so many things that are coming in our grocery stores that have, because of y'all don't have a chance. We're dealing with the smartest people in the world that are working in the food industry. It is engineered to suit the taste of your tongue. We don't have a chance. Okay. So that you've got to be careful. I mean, just being aware of these things might be very helpful to you. So you want to reduce your sugar levels. Did anybody guess what nutrients the Alzheimer's Association study was about? Anybody guess? The nutrient. What? Niacin. No, that's a good one. That's a good one. The nutrient that is responsible for reducing your risk of dementia by over 40%.
Protein.
Vitamin D?
Yes. Who said vitamin D? Yes, ma'am. What's your name?
Debbie.
Debbie. Yeah. It had to be a Debbie. She's Debbie. Debbie's are smart people. Wow. Yes, vitamin D3. Vitamin D3 is, they've studied it. I've actually done a whole talk on vitamin D, and I had to go do a deep dive, and I gotta tell you, that's one thing that you're looking for the Voltron. Anybody familiar with that term? Voltron? Voltron, okay, Avengers, Captain America, Iron Man. You know those? Okay, thank God. I thought I was speaking to the wrong crowd until here. Okay, so so the defender of your brain, we're beginning to find out. It's not that this nutrient itself does, it helps to create, it helps in so many different areas of brain health, including the synapses, the neurons itself. It helps strengthen and bolster. There's something called the perineural nets, which are the scaffolding of the brain. When the brain is making all these new connections, it's not haphazard. It's done according to a certain structure in place. Vitamin D helps in that, a whole bunch of different things. Anyway, bottom line, vitamin D helps with, so you need to have your levels well within the normal range. And I would say, between you and me, I would say closer to the higher end. Because neurologists are finding out, so the range is 30 to 100. Neurologists are finding out that especially those with sleep problems, mostly ladies, and those with menopausal issues, mostly ladies, I guess all ladies, right? Who really are struggling with menopause, they find out that 60, or it's only when they get past 60 or 70 that they start getting good results. A doctor would tell you 30 is fine. Go home, you're fine. Okay, so let's talk about the tests. So some of the things I would recommend, I mean there's like 7, but the things I want to highlight is like, you want to test your sugar levels, but more important, most doctors do not test for this. So I would strongly encourage you to specifically ask for it. It's called your insulin resistance, your ability, the levels of insulin in your body. Anybody heard about insulin resistance before? Okay, it's a big problem. Insulin resistance becomes bad way before blood sugar levels begin to rise. So your blood sugar levels could be perfect, but unless you test your insulin levels. And what we found out about insulin is that if your insulin levels are high, it means your brain is not responding to it. And there's a lot more that goes into it. But insulin is one of the top, also is a protector of your brain. So if your brain is not responding to insulin, you're on the path to dementia. All right, and of course you want to check your vitamin D3 levels. So those are the 3 that I really want to show up. Let's wrap this up. It's a whole new world we're in, folks. This is not the same world we were in before COVID-19. Very, very, very different world. And it starts to say that by 2060, new dementia cases per year could double to 1 million. That's from the Nature magazine, and it says that they will double over the next 35 years to about 1 million annually by 2060, and among Black Americans, it's going to triple. So folks, the devil is in the details. We've got to, again, I can't emphasize, different people have different risk factors to dementia. We need to meet them where they are and address them. I speak to healthcare professionals specifically. Action steps, I would say the simplest things you need to do, your activity levels, strengthen your legs, especially ladies, strengthening your legs and your calves and your thigh muscles. Sleep, get a sleep mask. That's the simplest thing you can do. Get a sleep mask. Your brain wants perfect, complete darkness. If you're not getting that, you're not sleeping well, I guarantee you. So you need to get good darkness. And then you want to reduce your sugar intake. I never knew, I thought black coffee simply meant no milk. I didn't know black coffee actually meant no sugar as well. So I've had to learn how to take coffee black as well. I mean, it shows you what a foreigner goes through when they come to this country. All right, so let's conclude. A journey of 1,000 miles starts with what? With one step. We've kind of like highlighted a few steps for you, just so you're aware of. But I would again have to say the number one step you want to look out for is the brain energy step. You've got to ensure that you're doing whatever you can to ensure your brain energy levels are adequate. So what we want is for everyone to be able to go from this to this. Thank you very much.
Okay, so what do y'all think? Are y'all walking out of here with some knowledge you didn't have when you came in? Was it worth your time coming for 1 hour, having some wine, some beer, some hors d'oeuvres, and listening to Dr. David? I think you can kind of see why we really want to go around to all the different communities and have him speak, because this is education. You're not hearing this anywhere else. And you all need to know about this. And he's got a lot to say, and there's even a lot more than just keeping your marbles. He is taking new clients. If any of you want to do a one-on-one with him, please reach out to him afterwards. If you would like to talk to any of us that are here tonight, myself and Deb and Connor Hanley, we can talk to you about other options if you want to look at assisted living or memory care, what you're dealing with. We're here to help you. We are a single resource for you, so reach out to us. We're free. Just reach out to us if you have any questions. But I want to applaud you for coming and thank you. And we're going to be having quite a few more of these as we start. This was our first one, so tell us that you want us to keep doing this and we will. So thank you very much. God, yes, I'm sorry. Questions? Would anybody like to? We did do that here.
I'm gonna let you speak. Well, yes, just use it.
What is the difference between Alzheimer's and dementia? Does dementia always lead to Alzheimer's? Or can you just have dementia for 5 years?
So dementia, I had a slide here. Thank you. So I had a slide, I'm just get back to it. Dementia is the umbrella term. Alzheimer's disease is a subsect of dementia. So dementia simply means the brain is degenerating, for lack of a better word. I don't want to use the word dying because that would probably not be the best thing, but it's an umbrella term meaning that cognition, memory, mood problems, brain is not working like as it should, but then there are different kinds that include Alzheimer's disease, and boy, I had a lot of slides.
So dementia is an umbrella, and every spoke on the
It's
umbrella
right
is
here.
a dementia.
Yeah.
Okay, so it's all under the umbrella of dementia, but you have Parkinson's, you have Lewy bodies, you have Alzheimer's,
Yeah.
all of them are. Okay,
That is right there.
right here, yes.
Does that answer the question? Yes, ma'am.
We've had a lot of great information about what to do to help prevent dementia
Yeah.
in all its forms, but what about people that are experience dementia now? I mean, is there anything that you have a suggestion or anything that they can do to help not stave off it maybe, but make it better, make their outcome better, help them reverse? Not reverse, I mean, I know there's no reversing, but is there anything that can be done to help them function better?
Short answer is yes. Long answer is that it takes a one-on-one kind of thing. I mean, I could say, take more vitamin D, but we've pretty much crossed that. We've passed that stage. You need the big guns, and you need to work very specifically with the caregiver who can administer. So I use a lot of things called nutrients and supplements and high dose. These are like are you familiar with the term nutraceuticals? So they're a cross between actual medications and nutrients.
So you do treat people with dementia?
I do.
I'll talk to you after.
Okay.
She has some friends.
Yeah, all her friends are right here.
Yes, ma'am, with the blue.
This is something very similar to her question, but while you were doing your speech, you talked about injuries to the brain.
Yes.
And I was thinking about John Mackey, a famous Baltimore Colt, who developed dementia and Alzheimer's from injury. And
Yes.
a lot of football players have done this.
Yes.
Then you have boxers,
Yes.
Muhammad Ali, the same thing. Is this research doing anything to help the people a major group of people that have gone through this?
Well, I know there's an organization that is specifically providing funds to help. I think John Mackey was the one who actually started his 88 or something. Yeah. I mean, so basically, there's a lot being done with regards to that. My challenge with it is that they still hold to the dogma that there's no treatment, and they're still looking for that drug that will remove the amyloid plaques, and they're spending billions on it. I'm not criticizing, I'm just saying that I think we also need to do other things like helping the brain generate more brain energy, and helping the brain repair itself, and helping the brain reduce inflammation, because inflammation too plays a huge role. So those are aspects that they would call people like me fringe quacks. What's the other word again? Those things. But there's a growing number of people like me who are very well established in this country, but they cost a lot of money, and yet the waiting list is really long. Mine not so much.
Thank you.
So this is also a legacy to pass down to the younger generation.
Yes.
This is a lesson, okay. So one thing I learned about attending the different speaking sessions with him is that we all have children, maybe grandchildren. This is information that you can pass down to, when does it start, in their 30s or 40s or 20s?
Yes.
So if they understand all this now, we may be able to stop this or slow it down. but it's all education. Everything we're doing here is education, awareness. This is the subject nobody wants to talk about. This is the one that makes everybody's skin crawl. But this is the #1 problem in America, around the world actually, that we need to talk about. We need to have a voice, and we need to pass it down to our children. We need to get them more into nutrients and exercise and the environment and saying no to things. And then we may be able to get ahead of this thing.
Yeah, thank you so much, Debbie. Yeah, I forgot to mention that. That's so important. Like I said, I was just so shocked at the amount of agency you all have as lay people. And if only you knew what to do and what not to do, we could, flatten the curve was an expression that was used during the pandemic. I'm telling you, we need to apply that to dementia. We need to flatten the curve, and that comes from everybody getting involved. Personally, if I were king for a day, I would make sure every medical personnel, nurse, doctor, whatever, was trained in dementia as well, because this is a catastrophe in the making. So.
Okay, thank you. Are there any other questions before we? Yes.
The proton pump inhibitor increase, does that have more to do with the medication itself or with leaky gut and lack of vagal nerve stimulation?
Good question. Yes, it affects the vagal nerve, it affects leaky gut, but also it shuts down the body's ability to produce things like intrinsic factor and it shuts down the body's ability to absorb certain nutrients the brain needs, like vitamin B12, like zinc, like magnesium. It inhibits the body's ability to absorb those things and send them to the brain. So it's a combination.
Cool, thank you.
Yep.
Okay. Is that it? Would anybody like to go on a tour of this beautiful Brightview community? If you do, Connor and Deborah are in the back of the room, and they'll be more than happy to show you this community. It really is quite a beautiful facility. Yes.
Okay, quick one. Just a quick request. Really, this is totally up to you. After my presentations, I usually ask if you would want to do a short 30-second